All month long, we have been talking about heart health and heart disease because February is American Heart Month. Caring for your heart can be a big key step forward for living a long, healthy, happy life. And more on that now from Dr. Sarah Schwertner from Primary Care Plus. Dr. Schwertner, good morning to you.
Good morning.
Let's start with this if we could. A lot of people think that a heart attack and heart disease are always the same thing. There are some differences.
Right. So heart disease, basically, it's a term that describes conditions that can affect how the heart how its structure and function, and how it pumps blood out to the rest of the body. And so some of those heart diseases that you may be familiar with is coronary artery disease, where the arteries that supply the blood to the heart build plaques in it. There's also arrhythmias. There's also congestive heart failure, and there's just a number of heart conditions that describe heart disease.
So heart failure would mean the heart simply it can't pump as much blood
Right.
as it should be, and then
Right.
arrhythmia would be an irregular heartbeat.
Yes, sir.
So what are the risk factors? Are they pretty much the same for all of these forms?
So basically, age is going to be a big risk factor. People who are over the age of 65 are more likely to have a heart attack. Also, if it's in your family, genetics. If you have a first-degree relative who's had a heart attack at a young age, you're probably more likely to have the same thing happen unless you get checked out by your doctor. And then certain conditions like diabetes, hyperlipidemia, and high blood pressure can also cause heart disease.
We talked about this the other day, but I think it was in another program, so it might be worthwhile to point out some of the common symptoms, that for people old enough to remember the TV show Sanford and Son, Fred Sanford was always grabbing his chest and saying he was coming to join you, Elizabeth. But it sometimes can just be a feeling of sickness in the stomach or just feeling really awful.
Yeah, so there's a number of symptoms that, you may want to get checked out by your doctor. So chest pain, of course, that's, heart attack. People know about that. Shortness of breath while doing activities. So sometimes that can mean your heart's not pumping correctly. And then also weakness, dizziness. They can all describe heart disease.
Look, if you're 85 years old and you have heart failure or heart disease, you may be well past the point at which, much of anything can help you based on the damage. But for people especially people who are younger, it can be reversed, can't it? The damage that you've done?
Yes. So if you have untreated high blood pressure and you get that under control, your heart muscle can actually repair itself. So getting your cholesterol under control, getting all those things under control can help your heart increase its function. If you catch it.
A little bit, which is one of the reasons to go to the doctor, know how you're doing, all those vital signs, if you will. All right, Dr. Sarah Schwertner, we appreciate that. Thanks so much.
Thank you.